Thank you so much, Dr. Holly Geyer, for being with us here today. We're continuing a conversation about this issue of addiction. In particular, we want to talk about if you get to the point of staging an intervention, and really, what are the key ways to prepare for one, and if you get to that point, what is it that you need to be aware of and think about as you're moving forward?
I think we're going to address a really key topic. This is something that many families will have to face, and when it's done wrong, you can feel the impact for a long time. I would tell families, first off, prepare for these to be challenging. When you recognize that, it can make things go a little smoother, and you can walk into it knowing the importance of being prepared. One of the first things you're going to do is gather as much evidence as you can from close friends, family members, to have that clear picture of the extent of the problem. We walk into these situations oftentimes myopic. We know our own perspective, but keep in mind, many people might be affected. More voices might be compelling. I'd also recommend creating a list of the unacceptable behaviors and consequences that person can experience if these behaviors are observed, right? Again, that comes back to setting those boundaries. And then consider who to invite to the meeting. Friends, parents, siblings, anyone directly impacted by that drug use can be very helpful to include. Also consider asking someone who's not directly in the family to attend. They can help lead the discussion, maybe a close spiritual advisor or religious figure, could be a social worker, the patient's primary care provider, maybe an addiction medicine specialist. There's a lot of options. And then choose a time and a place to have that conversation. You're going to want that person to be in a calm mood, a very low stress environment. It might be helpful to host the meeting outside of the home, and then make sure that you're planning out what you're going to say. Some people have found it helpful to have pre-written notes just to make sure that they're staying to the script.
So when you get to the point where you think you want to do an intervention, what are some really important things that you want to include when you do that?
Rule number one, you're going to want to set the tone for that conversation. Keep that tone calm, very clear, and clearly from a perspective that you're coming from love and concern while you're addressing the topic. You're going to want to focus your partnership with them, throughout the whole issue. Use I statements instead of you statements. Oftentimes, you statements can come across as feeling very accusatory. Example, if I were dealing with a loved one, I could say something like, I've noticed that more recently, or I can't help but feel concerned that, and finish the sentence. And then stay focused on facts and feelings. I wouldn't walk on eggshells. This is really that loved one's chance to be honest. Another important thing, stay on topic. Be prepared for accusations or to be blamed. That's oftentimes the norm, not the exception. Remember, this intervention is about them, not about you. There's going to be time to address all the other issues that have come along the path of addiction, or how you responded to them at one point during a harsh argument, and now they're accusing you of yelling and going back and forth. Keep to the topic. Again, writing down your script can oftentimes help you do that.
So what's a good way to kind of wrap up the discussion when you're doing an intervention, which is obviously the goal is to help get this person to go into a treatment program?
Closing time, Kim. End the conversation by proposing treatment options. And be glad you did your homework, right? Discuss how you'll help that person make their treatment a success, either through financial support or emotional support, or taking them to treatment, or fulfilling some necessary roles that they might have abandoned along the pathway of addiction. Remember, safety first, your family, you personally, throughout all this. I tell people, ask for an immediate decision at the end of your intervention. If they agree, fantastic. Work on immediate placement. Get them the treatment they need. This might be the most open period they're going to see from them in a long time. If they won't commit to treatment, be clear about the boundaries that you're going to hold them to and the lines that cannot be crossed, as well as the consequences they can expect, and then hold to them.
So what final thoughts would you have for people that are trying to assist their loved ones accessing treatment.
Remember, even though they may not be ready today, it doesn't mean they're not going to be ready in the near future. The odds of success are with you ultimately. So you're going to want to keep trying, look for opportunities, come from a position of compassion and from love, keep those doorways of communication open, and then again, hold firmly to the boundaries that don't enable.
And I think we should just wrap it up a little bit with the idea of, is this something that needs to be done with a professional, or can it be done on your own? Because clearly, I've had and heard many examples where not only could it be extraordinarily, expensive from a financial standpoint, it might be difficult, but also, there are, things to navigate as far as finding the right person to do this.
That's right. There's a lot of nuances that go into determining the optimal way to approach this. What I would say to people is feel out the environment. If you've got a loved one who's kind of been hedging on the issue of going to treatment, they recognize they have a disorder, there's not too many boundaries that need to be set or haven't already been set, this might be something that you and a handful of loved ones can accomplish. But if you've been in volatile conversations, if this person is screaming and shouting or has very little insight or throws, what could be construed as temper tantrums, and little interest in going to treatment, you're going to need assistance if it's to the point where you need to stage an intervention. And that's where I would say I'd get professional help.
And again, potentially using, support organizations or a counselor or a doctor or somebody that can recommend the right individuals that you can trust.
Absolutely. They're out there. You can look them up for your own community. Just look up the concept of intervention and see what comes up on a Google search.
And hopefully finding that right person, and then maybe if they can get into a treatment program, then hopefully we start to see what we're hoping to, which is them finally heading down the road of getting the help that they really do need.
You nailed it.
Well, thank you again, and we really appreciate it.
Happy to be with you, Kim.